have you here today. I want to personally thank Elsa and our senior community services staff, especially for this event and what they do every day. They do a great job, and we're very proud of them. And so I'm sure they're supposed to do well. That's their nature. So welcome here. We hope you have a great time. Hope you gain valuable information. I've been chatting with our speaker here, so I think we're in for an excellent presentation. So again, thank you for coming, and we hope you have a great day.
Well, before I go to my other job, because I have another job, I want to share my gratitude for the wonderful morning this we spending here and the time together. And when I was ready to leave, Elsa asked me for a favor, and I hear what was the favor request, and I said, well, I guess I will do it, because when you like someone, you do it. I have the honor to be here today and share with you. A few years ago, I met this individual that happened to be an energetic individual that has been working all over the country with a very specific scope and with more than anything else, with a wonderful way to communicate and to get people together. She suddenly worked in South Texas one day. She suddenly came to Corpus, and we enjoyed to start working with her. And we enjoyed what she produced and how she reciprocated. I am here to introduce an energetic, invigorating, intelligent woman. This is Carol Zernial. She is the director for WellMed.
Thanks, Dr. Gary. I was wondering who he was talking about. He said my name. I'm Carol Zernial. I am the Executive Director of the WellMed Charitable Foundation, as well as Vice President of Community Relations with WellMed. And so I've got just a couple of things that I wanted to do this morning. One is to say congratulations to TAAP for the summit. This is very exciting. I remember when we started talking about it, and then to see all of you here and make this a reality, it's wonderful. And thank you so much to Elsa and Lisa and Robert, Laura, the TAAP board. I'm sorry I don't know all of you by name for arranging this. It's my pleasure to represent the WellMed Charitable Foundation this morning, and I have a little surprise. What a lot of you don't know about WellMed Medical Management is that the employees of WellMed have a give campaign, and they give $10, $20 out of their paychecks, $5, whatever they want to give, to designated charities throughout the year. And one of the charities, WellMed is in San Antonio, Corpus Christi, El Paso, Austin, and the lower Rio Grande Valley. And so in Corpus Christi, the charity that they selected this past year was the Parks, Arts, Leisure, and Seniors Fund. So Michael, if you wouldn't mind coming back up. It's not a big check, literally it's not a big check, it's also not a big check. But it is a token of appreciation from the employees of WellMed who gave to your organization for the good work that you do here in Corpus. And so this is just to say thank you and then let you know we were thinking about you.
Thank you.
Don't spend it all in one place. You may have to, I'm not sure. When we started talking with the TAAP board about a possible summit, WellMed Charitable Foundation, in partnership with WellMed Medical Management, operates actually 5 senior centers across the state of Texas. We serve about 11,000 seniors in those senior centers. And so we know what it is that you all do every day. We know the importance of the senior center, of the nutrition programs, of being on the front lines. And I wanted to bring someone down who speaks your language and represents you in Washington, D.C., and you may not even know it. A lot of the gains and the stop loss, I guess, for the nutrition program has been the work of the National Association of Nutrition and Aging Services Providers at NANASP, of which Bob Blancato is the executive director. So we at WellMed wanted to bring him here. It's my pleasure to give you a little bit of background before he comes up. Bob is the president of Blancato and Associates and represents a variety of clients, all of which do good causes in Washington, D.C. He's the national coordinator of the 3,000-member Elder Justice Coalition. He serves as the executive director of the National Association of Nutrition Aging Service Programs. He has more than 20 years of federal government service in Congress, the executive branches, including appointment by President Clinton to be executive director of the 95 White House Conference on Aging. He's currently on the board of the American Society on Aging and the National Council on Aging. He holds a BA from Georgetown University and an MPA from American University. Bob has won numerous awards for his advocacy, including the Arthur Fleming Award, and in 2011, he was knighted by the Italian Republic for his commitment between the United States and Italy. Bob is an Italian-American, and Sir Bob, it is my pleasure. He was recently appointed as state president of ARP in his home state of Virginia, and I would like to welcome Bob Blancato.
Thank you very much, Carol. Sometimes when you read those introductions, it sounds like a living obituary. That's why I always ask it to be done quickly, so look back and see how many years you've been doing what you've been doing. It is great to be here at this summit. I remember some of the early discussions and planning that were being done. It's nice to be back in Corpus Christi. I realize it's been since 1994. Last time I was here, we did a White House Conference on Aging event at the then brand new museum. I was advised it was the museum that we were at, and I want to thank Elsa and her leadership, and Laura and Lisa, particularly Lisa, because Lisa realized about 30 minutes ago that there was no PowerPoint here, even though we claimed to be accepted. But things from Washington, you can't trust anybody from Washington. They tell you to send something that doesn't come down. I also want to salute our friends from TAAP and Robert in particular. But Carol, I got to take a second to talk about Carol. I mean, even though that the doctor just gave her this glowing these words, I mean, she really is in her own way a national leader in aging, having served on the boards of the National Association of Area Agencies and Aging, and together we serve on the National Council on Aging Board. So she has a reach that goes much farther than just the South Texas area. And her work with WellMed, I think, has benefited caregiving in this state and new initiatives. So it's wonderful that you're as involved as you are with this. And we at NANASP are very pleased to co-sponsor, in effect, this summit. I want to take a minute to introduce not only a presenter today, on one or two occasions, I guess, but I'm also a board member of NANASP. That's Pat Bowes, who many of you have met before. All right, now they tell me, I think this is on, let's see, if something happens. Let's see. All right, let's see if anything, there we go. Hey, guess what, I can make it, I can do it. I don't do PowerPoint very well. So this is about Washington, what's going on in Washington. How many people in this room have either shaken your head or shaken your fist at Washington in the past year? Raise your hand. Yeah, okay. Well, some of what I'm going to talk about today may make you do it again, maybe a little harder. We're going to do an update and talk about the issues, but also the importance of advocacy in terms of changing the outcome of some of the issues that we're talking about. And also the importance of TAAP and friends of TAAP and NANASP all working together going forward into the future. So, the first statement is very obvious. Since I'm from D.C., I'm a long way from home. I am a long way from home, but we are in the middle of very important, perhaps the most important summer recess I can remember that Congress is currently in. They're started on August 5th and they go until September 9th. They come back being associated with the least productive Congress in history, which for some people that's not a good thing. There have been small flashes of bipartisanship in Washington, most recently in saving the student loan problem from affecting millions of college kids when they went back to college, and the passage of the Violence Against Women Act. Somehow, these two things were able to get done by both parties working together. But that is not the norm. The norm is gridlock, and the norm is partisanship. And when you go to aging issues, it's especially a cloudy picture right now. The dominant issue, and the one I'm going to spend my time on in the very beginning, and where you're going to need to be getting involved even more, is sequestration, which in my judgment was the ultimate cop-out in Washington, D.C. Nobody ever thought it was going to happen, up until the day it happened. Now it's in its 6th month. So let me ask the question, how many people in this room have been impacted one way or another by sequestration? Raise your hand. Okay, you know what? I asked that question 2 months from now, everybody's hand will go up. Because that's the way sequestration is working. It's like a rolling boulder coming down a hill. It's a policy that says, in order for us to get lean, we have to get mean. That's not right. Okay? I'm all for deficit reduction, you're all for deficit reduction. But you can do it different ways than making across-the-board cuts, where you take good programs and bad programs and cut them all the same, no matter what the outcome is. And we know that critical services have been affected, from meals to transportation. We know of doctors who are turning away Medicare patients. We know about critical cooling assistance that is being wiped out in very difficult areas of this country. So the number one advocacy issue before us today is to end sequestration. And for it to happen, there has got to be a grassroots revolt in every part of this country. Everybody in this Texas congressional delegation needs to know the local impact of sequestration. Because if it is not stopped, and we get to October 1st, it's possible it can continue but double in size. Okay? The amount of the across-the-board cuts to go from the current 5%, where it is, to almost 9%. Now, in Washington, slowly, there's action that suggests that they may be thinking about changing sequestration. The Senate has passed a bill that would end sequestration at the end of September, and it goes to the floor in September. Now, for it to pass, you need a majority, obviously, and you need to talk to your 2 senators, notwithstanding what you may think their position may be. At the end of the day, all politics and policy is local. And if you point out what sequestration is doing to programs in the state of Texas, at least you have the right to go to them and ask them to come up with a different way to reduce our deficit. We need the House to buy in on this as well, to get both bodies to do it. Now, our two associations, NANASP and Meals on Wheels Association of America, we wrote a letter to Congress. They asked that a Dear Colleague letter, when you send it out to the House and you ask members to sign on, asking that the nutrition programs be exempt from sequestration going forward. We got 64 members of Congress to sign this letter in 24 hours on a bipartisan basis, including those 4 members from Texas. And I would point them out to you, and for those of you who are represented by these folks, make sure they get a thank you letter for their support of nutrition. But we need more support. We need you to contact your House member. If they sign that letter, and again, you go to nanasp.org and you get a copy of the letter, you thank them. If they didn't send that letter, or sign that letter, ask them to send their own letter, as was done before. Because the goal is to focus on nutrition for this reason. And there are colleagues in this room from the area agency world, I know, and Aging Network in general. You focus on nutrition because that's the most visible service that people understand in Washington. There are 3 programs they care about right now: Head Start, Research in the National Institutes of Health, and Senior Nutrition. So if we can get senior nutrition exempted from sequestration going forward, it'll benefit the rest of the age group over a short period of time. But the work you do in August, during this recess, can influence September when these big decisions are going to be made. How long the sequestration will last will be decided in September, because the fiscal year ends at the end of September. A stopgap bill will likely be passed to fund the government for the first month or 2 of the new fiscal year, but how that is funded becomes very important. So you really need to step up and point out and talk about the need to end sequestration as your number 1 advocacy goal. Make your voice heard. Let me move to the Older Americans Act, a program that many of you are familiar with, some of you administer, some of you have folks involved in the programs. You know, I was talking to a reporter on my way down here, which I shouldn't have been doing. I was driving, of course, but you know. Those 75-mile-an-hour speed limits and wide open roads, I love Texas. I love Texas. We have an interstate in Virginia called I-81. And one time I actually got pulled over, and I said to the cop, being facetious, I said, I thought that was a speed limit. But then you come here, and actually is a speed limit. So, this woman says to me, she's from Sarasota, and she says, you know, the Old Americans Act, why can't it get renewed? It used to be automatic. Every couple of years, you pass this program. It's the program that provides Meals on Wheels and senior center services and so on. My answer to her was, this is not a normal time. Okay? Even things that used to be automatic are no longer automatic. It takes more of an effort to get it done. So right now, we're supposed to be extending the Old Americans Act for a certain number of years. There is progress, it's slow, and I'm not sure how sure the progress is right now either. All the action is in the Senate at the moment. There's a bill, S-1028, that would reauthorize the Old Americans Act for 5 years. The co-sponsors of the bill are all Democrats to date, which is never a good sign. But there are bipartisan discussions at the staff level going on intended to try to produce a bill that both parties can support. The hope is to move that bill to the committee that is responsible for it, the Health Committee, in September. Then you go to the Senate floor, hopefully they pass it, and then you've got to get the House to engage. And so far, over the last 3 years, the House of Representatives has done nothing about the Older Americans Act, except for Congressman Hinojosa, who is a great leader, has been a champion of the Older Americans Act for as long as I've been up in Washington, and he's been in Washington. And advocates from his area should thank him for his work. But if we get an Older Americans Act done, don't expect something dramatic to happen. Don't expect big new funding, big new programs. It's likely to be just a simple renewal of the existing program, which is a missed opportunity. Because in our country, what is the fastest growing segment of the population? People 60 and over, right? So you take a law like an Older Americans Act, and you want to modernize it so it's ready for the next wave of people coming forward. But the political era does not allow for big bills to get passed in that area. But I also told this woman in Florida, I said, look, you know, advocates make noise on a lot of issues. But there's not enough noise being made about the Older Americans Act. It's a program of great value. So if you want a bipartisan message, if you can send a message to Republicans and Democrats to talk about how a program, because of the way it's set up, saves your programs like Medicare and Medicaid real dollars, they'll listen. So let me give you a good example. I'm involved with the nutrition programs, as was pointed out. You've got the average age of people who come to get a meal in the nutrition programs is in the upper 70s in our country. And those who don't get home delivered meals in the low 80s. Eligibility is 60 for the nutrition program. A number of these people were assessed as being at risk of being institutionalized or hospitalized because of the failure to maintain a proper diet. 20% of people in nursing homes are there for that reason. So with that in mind, if the people are in the program 15 and 20 years later and still showing up every day and still getting their meals at home and not weighing on the Medicaid or Medicaid system, you're saving millions of dollars. But that message needs to be delivered more strongly to get an Older Americans Act passed. But you can talk that message, you can make that point as people in the aging network. And you've got a job to do. You've got to educate a new senator. Okay? Anybody that comes to Washington, there's a lot of new people in Washington. New people have no history with prior programs. You've got to assume you have to start from scratch. And I'm urging everyone in this room to make an effort to educate Senator Cruz about the Older Americans Act so he's aware of it when it comes before him in September for a vote. And for those of you who want a White House conference on aging again, and I know our friends in the Silver Hair Legislature and Congress are here at the national level would like to see one done, this is how it gets done to an Older Americans Act. Let me talk about another bill that's very important that we should be concerned about, and that's the Farm Bill. Another bill that's been stalled for many years. It used to be automatic, okay? A bill that brings farmers together, nutrition people, city people, urban people together. It's also a victim of today's environment. But a Farm Bill is really important to this state, knowing how big the agricultural world is in the state of Texas. But the fight right now about the Farm Bill has nothing to do with crops. Okay, or who grows what, or who does what. It's about the food stamp program. Okay, the Supplemental Nutrition Assistance Program, which has skyrocketed in the number of people in the program because of the recession. Okay? Because you've made more people eligible for the program, the response has been dramatic. 46 million people are now in this program. But look what it has done. Putting the people on the SNAP program has helped reduce the poverty level by 8% in 2009 when they gave the SNAP program more money. You have a bill that passed the House, which I'm still shocked at. It takes a lot to get me shocked these days after being working in Washington for 30 years. They passed a farm bill to take all the nutrition programs out of it. No money for SNAP, no money for Senior Farmers Market, no money for the Commodity Supplemental Feeding Program. That's insane. So here again, you've got a Senate farm bill that would support these programs, but the fight from our end has got to be dealing with those programs like SNAP, like the Senior Farmers Market Program. They need to continue. They are important for keeping older people healthy and in the community. So spend some time learning about the farm bill, do some advocacy on it. We may be dealing with a one-year solution for the farm bill, but I think it's something we want you to spend some time on. You can come to our website anytime you want at nanasp.org and we'll talk more about it. Entitlement reform. Okay. It's always on the horizon. Medicare, Social Security, Medicaid. Okay? The big three programs that we're all familiar with, and anybody who works in aging knows that. The question is what's included and what's excluded. It's all an open question right now. We have another crisis. Washington lives from crisis to crisis, as you know. And the fact that I gave you a word association game, and I said to you, Congress, okay, I would bet the next word out of your mouth wouldn't be foresight. Okay? I mean, unless the gun is cocked at the head, they don't do anything. Okay? It's got to be right on the doorstep. Okay? Well, we have that problem. With our debt ceiling, we run up against our debt ceiling at the end of the year, and we default on our obligations. Well, that's a big problem. So they're going to address that later in the year, and usually when they come to that juncture, they start talking about grand bargains. You should always be nervous when you hear the word grand bargain coming out of Washington, because you don't know whether or not your program is going to come out in good shape or in bad shape. But there are all kinds of proposals out there for entitlement reform. The President himself came up with a proposal to change the way we calculate the Consumer Price Index every year. When seniors get a cost of living increase under Social Security, the President would change the way they go about doing that, which was a big surprise for a lot of people, because that, in effect, is a cut. Okay? It's a cut. And today in our country, 1/3 of older people on Social Security is 90% of their income. They can't afford a change in the CPI to live from year to year. There's always talk about raising the eligibility under Medicare, which is now 65. Talk about raising to 66 or 67. Well, what does that go against? Here we are on an effort to reduce the number of people who are uninsured in this country. You raise the eligibility age under Medicare, you'll bring millions of new people into the ranks of being uninsured. But it's talked about. Block granting Medicaid, having the states run the Medicaid program completely, is talked about on a regular basis. I don't have an answer for you. I don't have a crystal ball that's going to tell you what's going to happen on entitlement reform. I just say wait and see, stay close to this issue. The time will come when your voice is going to be needed either to support something or to oppose something. But pay particular attention to the issue of Medicare Part D, the prescription drug program, which started off in a very controversial way, but now it is enjoyed by a lot of seniors, and there's some changes that could be coming. Long-term care. I refer to this as America's denial issue. We're in total denial about the need to pass long-term care legislation in this country. It's kind of like this other question. How many people in this room are baby boomers? Raise your hand. And how many of you are in denial about aging? Raise your hand. Okay. So you get my point. This is America's long-term care denial is a denial issue. We had a program in the Affordable Care Act that was going to start the process rolling called the Class Act, that was going to have people paid for 5 years into an insurance plan and then get a daily benefit. But unfortunately, they couldn't make the case that they could sustain it over the long term, and as a result, it was repealed. And now they have a new commission, which is another way Washington avoids issues by creating commissions and doing studies. But this one is actually working to try to come up with a proposal, and we're hoping that there's a report they'll give out by the end of the year that can help us look down the road for long-term care. And unless it's done in a public-private partnership, it's never going to work. Elder justice, an issue that I care a lot about, We're making progress since the Elder Justice Act was passed. I remember standing in Kerrville, Texas, the day the Affordable Care Act was signed into law, which included the Elder Justice Act. Very proud moment. A lot of people in Texas had a lot to do with getting an Elder Justice Act passed. It's all about elder abuse prevention, having the federal government step up. In case we've lost track, 1 out of every 10 seniors in this country is a victim of elder abuse. And when you calculate how much victims of elder financial abuse lose a year, it's almost $4 billion a year. And we're talking about people whose life savings go out the door by one phone call when they get scammed. Or one person coming down the street saying, can I fix your roof? I see a big hole in your roof. What, you know, and they say, yeah. Why does that happen? Because a lot of times these are older people living by themselves with no contact with the outside world until somebody comes along and takes advantage of it. So we have money being available. There's a great grant that Carol's involved with in the state of Texas that will bring together the concept of having an APS workers working in health clinics so we can have better education processes going forward, more people understand it. Because elder abuse is very simple in this sense. You can't stop what you don't report. Okay? And people need to report it, but they need to understand what elder abuse is. If an older person shows up in an emergency room with a bruise, don't always assume it's a fall. Okay? It could be a victim of physical abuse. But unless you do the forensics necessary to train people, it's never going to happen. But there are a lot of good things going on right now in Washington with the Elder Justice Coordinating Council. The Consumer Financial Protection Bureau has a new Office of Older Americans. I urge you to go to cfpb.gov, learn about what they're doing to fight financial abuse against older people. And there's a lot of bills that have been introduced. Now, sometimes when you do these kind of presentations, you add things at the last minute to your slide. So you're not going to see what I'm going to talk about on the slide now because I wrote it on this piece of paper in front of me. I want to talk about immigration reform because that's a very important issue going forward. That's going to come before the House of Representatives in September. Okay? The Senate has passed the bill, and the key, obviously, the key issues there deal with the pathway to citizenship, protecting the border, and what kind of benefits are people going to be eligible for. We've got to look very honestly at the issue of immigration reform going forward. It's an intergenerational issue because we have immigrants from all ages in this country who have been here. Study the bill very carefully. The bill that came out of the Senate would lower our deficit, would create jobs in many congressional districts. But it's also an issue that older people and their advocates need to get more involved. The voices have been very quiet on this issue, so I wanted to put that on the table going forward. The Affordable Care Act. Well, you know, we know that this has been a tough week for the Affordable Care Act and Texas politicians. I understand Senator Cruz had a little encounter at a town hall meeting, you know, with the Affordable Care Act, and I know your governor has just decided that he now does want to pursue receiving funds from the Community First Choice program, which was part of the Affordable Care Act, even though he's a strong opponent to the act as there is. So, all that being said, Texas is going to operate a federally operated exchange program where people can start enrolling on October 1st. The focus right now, from now to October 1st, but remember, people are getting confused about this. There are two things to remember about the Affordable Care Act. One is you can enroll from October till March. It doesn't mean you can't, people think if you don't get enrolled by October 1st in the exchange, you're going to be knocked out. You've got 6 months to enroll, okay? And second of all, nothing, if any senior comes to you and says, my Medicare is going to change as a result of these exchanges and so on, is not true. So right now the job is to get as many people who are eligible to be enrolled in these exchanges enrolled as possible by doing education, outreach, and enrollment. In your state, a range of what they call navigators were just announced about 2 weeks ago, and one of the larger ones was the United Way up in Tarrant County, and there's other ones around the state. If you're involved in this issue, you need to know who those navigators are. If you go to healthcare.gov, very simple, healthcare.gov, you can learn all of what's going on with the Affordable Care Act going forward. And there's an important role for TAAP, in my judgment, as there is for everybody in the aging network, to help do the education, outreach, and enrollment. Because you have access to people, and you're a trusted entity, so you should take advantage of that going forward. All right, so advocacy tips. The simplest one of all, just do it. Okay? People say, what can I do? What should I do? Well, there's a very simple issue. I'll go back to it from where I started. Ending sequestration. Okay? Ending a policy of across-the-board cuts. It's here, it's present, and a future danger to those people that you serve. Pure and simple. You need to get the data together, especially in nutrition and senior center services. You need to go with that Dear Colleague letter and get your members of Congress to send their own in. And you need to ask a commitment from your member. Are you prepared to support an end to sequestration? And when you get an answer, make sure you publicize that answer in your local community so people know where they stand. On Older Americans Act advocacy, it's about the Senate. Okay, you need to focus on your two senators to try to get them to support a bill that will come out of the Senate this month to reauthorize the Older Americans Act. And I'm not going to try to prejudge. My hunch is that a bipartisan bill can get both your senators' support and we can get something done this year. And if you want a message to use, go to our site, nanasp.org, and we have messages about how to communicate about the Older Americans Act. Medicare Part D, I find this hard to believe. It's going to be 10 years old in December. Remember when it started? What chaos there was? You know, if you ask somebody, what's the D stand for in Medicare Part D, you got all kinds of answers. Yeah, dumb, all kinds of things, right? Well, now look at it. 90% satisfaction rate among seniors. They're going to come out with a new survey next week about this. 28 million people are enrolled, saving $12 billion a year. The premiums have been steady, deductibles have been dropping. So when they start talking about changes to Medicare Part D, just try to avoid those that would increase premiums and limit choice for seniors at a point when they enjoy the program. All right, let me go to the part about an emerging partnership that we hope comes from this summit and things that happen beyond. NANASP and TAAP working together makes sense for both our organizations. We're a national organization with 1,100 members on the ground working in districts and states across the country, which gives us a great grassroots voice, okay? Because what do we have working for us as you have working for you? You deal with seniors every day, okay? There are people in the aging network who don't see seniors for a month, yet they're in the aging network. In the nutrition world, you see them every day. They come to your programs, you see them in their homes. That's grassroots at its best. But we need more of a presence in the state of Texas. Our members are distinct because of why they work, and when you speak on their behalf, you give a much more authentic voice. The benefits for being involved in NANASP are mutual. We bring advocacy with good and accurate information at its core strength. We're one of the leading voices for nutrition in Washington, and we can help impact your bottom line if we can succeed in getting things averted or more money coming in. We get grants, which we're proud to share with our members, called Advocacy Begins at Home. We ask you to go do some very specific things with your members of Congress. I mean, these grants average $5,000 a year, and we've awarded a number of them in the past couple of years. We just completed, and now apparently we may be renewing an effort called the Don't Empty My Plate campaign, where seniors were signing paper plates on sequestration, urging members to stop supporting sequestration. And go to our site if you want to be involved in that as well. We're finding people have really gotten engaged in that program. We partner at the national level with a whole range of organizations, the Leadership Council of Aging Organizations, the Elder Justice Coalition. We collaborate on advocacy very closely with the Meals on Wheels Association for a very simple reason, because our members want us to. Our seniors want us to. We also work with the Academy of Nutrition and Dietetics, or the Old American Dietetic Association, and we work with the National Institute of Senior Centers and NCOA. And we did a joint conference, a unique joint conference in 2010 with an AIDS-based organization who had food nutrition services for people with HIV and other illnesses for one reason. Both our populations were aging, and we need to learn the best methods of how to do those services going forward. We work for our members. We think we offer good value for membership. We have a national webinar series on a range of topics that our members suggest, and sometimes we put forward to them. We could partner with you on state chapters and conferences. And we feature a high-quality conference every year tailored to the needs of senior centers, nutrition programs, and aging professionals. And I'm proud to hit the next slide, which shows you where we will be in the next year. In fact, I was up last night and I saw the Westin Hotel, the property that we're using. It's beautiful, it's new, it does end up on the water, it's on the River Walk. And it was very nice to see, and this is an open invitation. And we have special arrangements, I think, for people from Texas to come to this conference. That if you go to our site or maybe the materials that are on the table. But I can't encourage you more. Whenever a national conference comes to your backyard, okay, and you're involved in the area, first you should come as a participant, but also you might be people who can help do workshops. You might be doing best practices here that we could learn from, that your colleagues around the nation could learn from. So I really do encourage you to think about coming. So, in closing, and yes, people in Washington do know how to close a speech. We see good opportunity and synergy in building a closer relationship with TAAP. We think we can give you stronger national advocacy resources, training, and education opportunities. You would give us a solid presence in Texas and a great base to build our 2014 conference on. So just like I said about advocacy, let's do it. Let's move this partnership forward. And thank you very much for the chance to speak to you today. So. And again, thank you, Lisa, for rescuing the PowerPoint. We didn't have it until a little while ago. So this would now be your opportunity to ask a question, make a comment. Even if it was on something I didn't talk about, I'll try to answer it. But this is part of advocacy now. Yes, sir.
How is the Texas legislature working with you in Washington? Do you have a presence up there?
Well, I imagine it's more with your own congressional delegation than it is necessarily with the NANASP. I mean, I personally am familiar with your association and have for years and know a lot of people in there. And it turns out that a lot of your Texas folks are also involved in the National Civil Care Congress, which we do interact with. I'm on the advisory council for the National Civil Care Congress, and I've known folks like the great the late Homer Lear, who was a very dear friend of mine for many years, and Carlos Higgins, and Oscar Garcia, and Chris Kiker, and now yourself as well. So what I think is the best answer to that is we will work closely on things that if you bring it to our attention, if there's something we can do to be helpful, I'm more than happy to. And Pat Porter, just remember Pat too, another person who I deal with on a regular basis. So feel free. You have my card, we just exchanged it before, so don't be shy.
Appreciate it.
Other questions or comments? Yes?
What's the anticipated ratio, or is there a ratio, nursing home to assisted living, appropriate care, or are a lot of the nursing homes trying to, I have heard that a lot of the nursing homes are trying to make a combined effort to have more of a assisted living type atmosphere. I don't see anything, how that's going to work at this point with what we have going right now.
Right. Yeah, and that's a good question. I mean, first of all, let's put one very important thing in context, which sometimes people forget. And maybe you know the answer. What percentage of older people in this country are in nursing homes? Anybody take a guess? How many people think it's 20% or more? Raise your hand. How many people think it's 10% or more? Raise your hand. How many people think it's 5% or less? Raise your hand. That's the answer. 5%. Okay. So, because of that, when the federal dollars that were going in healthcare were being directed primarily in institutional care, suddenly the decision was made, look, there's got to be alternatives to that. Home community-based services being one of the Medicaid waivers that came about as a result of it. But in the meantime, the assisted living industry was developing as a sort of middle ground between nursing home care and just pure home care. There have been difficulties in both arenas. The skilled nursing home world is facing some major potential cuts that are reflective of the fact that there's flat growth in nursing homes at this point around the country. Assisted living's issue is more around the regulation side of things. Okay, how they're regulated. It hasn't been federal in nature. A lot of it's been state in nature. But there's growing concern. There was just a big frontline news report about assisted living that apparently has created quite a stir about the need to do some stronger regulation about what's provided in assisted living and what's the value for the person who's paying that amount of money for assisted living services. So I think the concept of them working more closely together, I don't see necessarily. Okay, what I do see are two industries that are going to be under the spotlight for the foreseeable future from a cost standpoint and a regulatory standpoint. Because anytime you create industries, you have to have accountability. And for a long period of time, the nursing home industry, and there's some great nursing homes in this country, and there's some terrible nursing homes in this But they pretty much had pretty much of a free ride up until laws like what they call the Oprah law in the late 80s came along. But now their issue is survival. And it's going to be interesting to see how that plays itself out and how the assisted living side of things benefits from that if they do, or they themselves become under the spotlight, which makes it even more of a challenge. So, good question. Anybody else? Question? Yes?
Could you talk a little more about sequestration of the Older Americans Act? You said the 5% cut that the national cut was 5% could go to 9%. Well, locally, it hit us even harder because of the demographics of the coastal bend. We had about an 11% cut in FY13.
Right, and you raise a very good point that you hear all over the country. You hear a flat number like 5%, but in reality, for programs like the Older Americans Act, there's tremendous variation by counties and by cities and whatever because of formulas and other things of that nature. But the core issue is if your core number goes from 5 to 9%, okay, and you saw what a 5% cut meant in real terms, just take it out to a level that's 9%, and you could just imagine what the next thing that's going to come down. The reality of it is, and again, this reporter was asking this question, and I said this before, and I mean it, and you know this is true. Some of you could nod your head when I say it. Because sequestration took such a long time to actually go into effect this year. First you delay it from January to March, you go from 8% down to 5%, and then by the time it goes from the feds to the states down to localities, there's a period of time to get prepared. Okay? And you creative people in this network around the country have found those band-aids and those bandages and covered them all up and got that funding source that brought you the, that saved you for the period of time. But you know what, I don't know, I would say probably 90% of those people, those band-aids start peeling off on October 1st if you have another wave of sequestration that's bigger than what you have right now. So rather than trying to, anticipate what is going to happen, I think the effort has got to be from the part of anybody who's doing any work on behalf of kids and seniors and scientists. It's got to be to end sequestration. This policy is wrong. It doesn't need. Put it another way, if you want to put it in, because you're going to get some people saying, okay, what's your idea? What's your alternative? Well, guess what? Two things. One, the economy is actually improving. There are more revenues coming into the economy than there were 6 months ago. Okay? Remember how we bailed out the Fannie Mae's and the Freddie Macs and the General Motors? Well, guess what? They've all finished and paid up, and they're starting to put more money into the Treasury. That offsets the need to go to across-the-board cuts to achieve deficit reduction. Because you achieve deficit reduction two ways. You cut spending and you raise revenue. Well, more revenues are here. So you could say to a member of Congress, look at what's coming in on the new revenue side, and then from there say, we don't need a sequestration to help get the deficit reduction. But what's going to work with people is they need to understand what it means in real practical terms. Our estimates are 4 to 5 million meals alone will be eliminated between now and October 1st because of this year's sequestration. Okay? Jump ahead to the next one, and then we can do the math from there. So, and look, I was at your conference in Louisville, and I know how there's a lot of work being done at the AAA level to stop this, and we just have to all do it together. And TAAP needs to take a stand. This is a great place for you to start and get your advocacy message clear and strong, and to as many people in your congressional delegation as possible, because that's really what it's about. They need to hear the local story. Anything else? Pat, is there anything you want to add from the NANASP perspective?
I do.
How do I know that?
If you look at the sheet that's on your tables, NANASP is providing you with a free membership from now until the end of the year, so you can sign up and get on our e-blast and all the information that we have. So please feel free to sign up as soon as you can. Thank you.
And don't forget, just think about coming to San Antonio and coming to a national conference and actually playing a role. And, from that could come a number of good things, good education, good times, meet some people, some of your colleagues from around the country. I've learned from having seen enough NANASP conferences that the conversations that go on in the hallways, and people meet each other for the first time and they, what are you doing about this? And tell me about this program you're doing here. These are what makes these things so worthwhile. We're not some big giant 4,000 where you get lost in, a poster session behind some poster board or something. No, we're like down to the basics. We have good, solid 25, 30 member sessions, and our opening session is interactive. So keep that in mind, and if you've ever had an opportunity to want to go to a conference, I think we have one for you. So we have now reached the hour of 1 o'clock, and the world says this lunch is over. So see you all later. Thank you.